Are you working past age 65 or helping a family member who is? Then you're staring down a few key Medicare decisions that can make or break your retirement plan. There's a lot of confusing and sometimes flat out wrong information out there. And when it comes to Medicare, mistakes aren't easy to fix. Get them wrong and you could be on the hook for thousands of dollars or lifelong penalties you'll never shake. I'm David Kurtz with Senior Benefit Services, and for more than 30 years, we've been helping seniors across 42 states, especially right here in Maryland and surrounding areas like Pennsylvania, Virginia, West Virginia, find Medicare coverage that actually makes sense for their lives and budgets. Our goal is simple: make the complex parts of Medicare crystal clear so you can make confident decisions. Today, let's go through the 7 most common mistakes people make when working past 65 and how you can avoid every single one of them. Now, mistake number 1 is not understanding how the size of your employer affects your Medicare rules. This one is huge because it determines who pays first, your employer plan or Medicare. If you or your spouse actively work for a small employer, which is fewer than 20 employees, then Medicare becomes your primary insurance when you turn 65. That means Medicare pays first and your group plan pays second. You generally need Part A and Part B to avoid gaps and denials in the secondary plan. That means you must definitely you should enroll in Medicare Parts A and B. If you don't, your plan becomes secondary, and that secondary plan may pay little to nothing. In that case, you'd be the one footing the bill. And trust me, a few uncovered hospital days or outpatient procedures can easily cost thousands of dollars. So if your company has fewer than 20 employees, go ahead and enroll in both Part A and Part B at age 65. Now let's take a look at a quick example of this. Jennifer works for a small accounting firm in Frederick, Maryland, with just 12 employees. When she turned 65, she decided to delay Medicare Part B because she assumed her employer insurance would continue paying as usual. So a few months later, she had a knee replacement surgery done, only to learn that her employer plan was secondary to Medicare. Since she wasn't enrolled in Part B of Medicare, it denied most of the bill. Jennifer was left responsible for thousands of dollars in medical costs that Medicare would have covered had she simply signed up for both Parts A and Part B when she became eligible. If your employer has 20 or more employees, the situation flips. Your employer coverage is primary and Medicare becomes secondary. In that case, you could delay Part B without penalty until you retire. Most folks still take Part A since it's premium free, but they wait on Part B to avoid paying that extra monthly premium while they're still working. Let's look at a quick example of how this situation would work. Nancy works for a large consulting firm in Hagerstown, Maryland, with about 60 employees. When she turned 65, she checked with her HR department and confirmed her employer's group health plan would remain primary because the company had more than 20 employees. Based on that, she decided to delay Medicare Part B to avoid paying the monthly premium while still being fully covered under her employer insurance. When she later retired at age 68, she enrolled in Medicare Part B during her special enrollment period with no penalty since she had followed the proper rules for a large employer plan. Now let's look at mistake number 2. Missing your initial enrollment period, commonly referred to as your IEP, when you're required to enroll. Your IEP is a 7-month window that starts 3 months before your 65th birthday and ends 3 months after your 65th birthday. If you sign up the month you turn 65 or in the 3 months after, it is important to know that your Medicare coverage will not go into effect until the first day of the month after you sign up. If you're required to enroll at 65, say because you're covered by a small employer plan or an ACA marketplace plan, and you wait until your birthday month or later, your coverage start date will be delayed by 1 to 3 months. That gap can turn into a financial disaster very quickly. One medical event without your coverage can drain your savings overnight. Here's a quick example of how this mistake can cost you. Robert, who works for a small construction company with about 10 employees, which means he needed to enroll in Medicare when he turned 65. His initial enrollment period, remember we talked about that, that's his IEP, started 3 months before his birthday month, but he waited until after his birthday to sign up. Because of that delay, his Medicare coverage didn't begin until 2 months later. Unfortunately, during that gap, Robert had an unexpected hospital stay after a fall. Since he had no active coverage at the time, he was personally responsible for nearly $9,000 in medical bills that would have been covered if he had enrolled on time. Let's look at mistake number 3, mismanaging your special enrollment period when you retire. Your special enrollment period is commonly referred to as your SEP. If you delay Part B because you are on a large employer plan, you get an 8-month SEP after your active employment ends or your credible coverage ends. Here's the trap that catches a lot of folks. COBRA and retiree plans don't count as active coverage once you retire. Medicare becomes your primary and COBRA becomes your secondary. If you stay on COBRA past that 8-month window and forget to enroll in Medicare Part B, you'll owe a permanent late enrollment penalty, which is around 10% added to your premium for every full 12 months you delayed. And that penalty sticks for life. An example of this mistake would be Linda, who retired from a marketing firm with 45 employees at age 67. Since her employee coverage had been primary, she qualified for an 8-month special enrollment period to sign up for Medicare Part B. However, her company offered COBRA, and she assumed that staying on it counted as active coverage, so she waited a full year before applying for Medicare Part B. When she finally tried to enroll, she discovered she had missed her SEP and was hit with a lifetime 10% late enrollment penalty for every 12 months delayed. That mistake increased her monthly Medicare Part B premium permanently, all because she didn't realize COBRA doesn't qualify as active employer coverage once she retired. To activate your special election period, or commonly known as the SEP, you'll need 2 forms. CMS 40B, your Medicare Part B application, and CMS L564, which is your employer verification form. Your HR department needs to fill that second one out to confirm you had credible coverage. Start this process 2 to 4 months before you want Medicare to begin, especially if you're in areas like Cumberland or Frederick, Maryland, where processing times can vary. Give yourself a cushion. Mistake number 4, mishandling your HSA when you enroll in Medicare. Once you sign up for any part of Medicare, even just Part A, you can no longer contribute to an HSA, commonly known as a health savings account. And here's the kicker. Medicare Part A can be backdated up to 6 months, but never before your 65th birthday. To avoid a tax penalty, the IRS recommends you and your employer stop HSA contributions 6 months before retirement or applying for Social Security. Here's an example of how this mistake could cost you. Mark worked for a mid-sized construction firm and had been diligently contributing to his health savings account for years. When he turned 65, he decided to enroll in Medicare Part A while continuing to work and contribute to his HSA, thinking it was harmless. 6 months later, while filing taxes, he learned that Medicare Part A coverage had been retroactive to the date he became eligible, causing all of his HSA contributions made during that period to be ineligible. As a result, Mark faced IRS tax penalties and had to withdraw those contributions. Had he stopped contributing 6 months before enrolling in Medicare, he would have avoided the penalty entirely. You can still spend the HSA funds you've built up for qualified medical expenses, but new contributions must stop. So let's look at mistake number 5. Not comparing your employer coverage to Medicare. Just because you can stay on your employer plan doesn't mean you should. Take a good look at your plan's premiums, copays, deductibles, and the maximum out-of-pocket cost for each year. Compare that to Medicare. For example, the standard Medicare Part B premium in 2025 is about $185 a month. If your job-based plan costs $200 to $250 a month or more, Medicare might save you money. Pairing Part B with a Medigap Plan G, which runs roughly about $150 a month in areas of Maryland, such as Hagerstown, Frederick, Westminster, and Cumberland, well, that could drastically cut or even eliminate copays and deductibles for approved services. It is important to note that in areas such as like Pennsylvania, that has cities and towns of Greencastle, Chambersburg, Gettysburg, and Somerset, a Plan G will be around $135 per month. And in areas such as Bedford, Pennsylvania, it will be around $145 a month. But remember, Medicare is individual coverage. If your spouse or kids are still covered under your work plan, switching to Medicare could leave them unprotected. In that case, you might want to hold off until they're covered elsewhere. So how would this work in a real case scenario? Tom works for a manufacturing company that offers an employer health plan costing him around $240 a month with a $3,000 deductible. When he turned 65, he assumed staying on the plan was best since it was familiar to him. After comparing options, he learned Medicare Part B would cost him about $185 a month, and a Medigap Plan G in Gettysburg, Pennsylvania would run him about $135 a month. Together, the total, roughly around $320 a month, would give him far lower out-of-pocket costs and broader coverage than his employer plan. However, because Tom's wife was still covered under his job's insurance, switching to Medicare immediately would have left her without coverage. He chose to wait until she became eligible for her own plan before enrolling. Let's look at mistake number 6, forgetting about Part D prescription drug coverage. If you delay Part B, you can usually delay Part D as a David, but only if your employer drug coverage is considered to be credible. Your HR department should send you that notice each year. If you go more than 63 days without credible coverage, you'll face another lifelong penalty, 1% added to your Part D premium for every month you delayed. It's also important to remember that the penalty is based on the national average and not the price of the Part D plan you're looking to enroll in. An example of this would be if you live in Martinsburg, West Virginia, let's say, and you want to enroll in around a $14 a month Part D plan. Now let's assume that you delayed enrolling in Part D when first eligible by 24 months, which equates to about a 24% penalty. Does that mean you pay an extra $3.36 per month on top of the $14 per month for the plan you were going to choose? Sorry, but no. The 24% penalty is going to be based off the national average of Part D plans, which in 2025 is $36.78. So this means your actual penalty would be $8.83 per month on top of the $14 per month for the plan premium. This means that your cost would be $22.83 for that same Part D plan that would have only cost $14 if you hadn't delayed enrolling when first eligible into Medicare Part D. Now, let's look at this. Patricia worked for a mid-sized insurance agency in Martinsburg, West Virginia. When she turned 65, she kept her employer's health coverage, but didn't check whether her prescription plan was credible. 2 years later, after retiring, she went to enroll in a Medicare Part D plan costing, we talked about, $14 per month. Because she had gone 24 months without credible drug coverage, she was hit with a 24% late enrollment penalty. Since the penalty is based on the national average premium of $36.78 per month, not her plan's price, she owed an extra $8.83 each month for life. Her total cost became $22.83 per month instead of $14 per month, all due to missing that credible coverage confirmation from Human Resources. While you have 8 months to sign up for Part B, your window for Part D is often much shorter, sometimes just 2 months, so you'll need to move quickly when that employer coverage ends. Now let's look at mistake number 7, not managing automatic enrollment if you're already collecting Social Security. If you're drawing Social Security at least 4 months before age 65, Medicare will automatically enroll you in Parts A and B at age 65. That sounds nice, but if you're still working for a large employer, remember that's 20 or more employees, you may not want Part B yet. If you don't actively decline it, you'll end up paying around $185 a month for coverage that's secondary to your employer plan. That's just throwing money away. Here's a quick example of how this mistake costs folks. James began collecting Social Security at age 64 while continuing to work full-time for a large logistics company with over 100 employees. When he turned 65, Medicare automatically enrolled him in Parts A and B because he was already receiving Social Security benefits. Since his employer coverage remained primary, he didn't need Part B yet, but he never sent in the form to decline it. As a result, $185 was automatically deducted from his Social Security check each month for a benefit that didn't pay first and rarely covered anything. Had James declined Part B before his coverage started, he could have saved that money until retirement. Working past 65 doesn't have to be stressful, but the truth is the rules do get tricky fast. Between employer size, enrollment periods, HSAs, and penalties, one small mistake can snowball into thousands of dollars in avoidable costs. At Senior Benefit Services, we spent decades helping seniors make clean, confident Medicare decisions without the stress, confusion, or fine print surprises. We're independent agents, which means we represent dozens of top-rated companies, not just one. Our service costs you nothing, and we stay with you year after year to make sure your coverage still fits your needs. If you want help comparing your job's benefits to your Medicare options, just give us a call at 1-800-924-4727 or visit our website at www.seniorbenefitclient.com. Additionally, if you would like to keep up to date on all things Medicare, be sure to click on that subscribe button below. We'll help you cut through the confusion and find the right fit for your situation. Thanks for watching, and we'll see you next time.